The instruction of machine operation, according the customer feeling to adjust the energy when we do operation.
For HIFU, we can adjust the energy from 0.5 joule. If stored with 3 and 0.5 cartridges, it is recommended to use HIFU and EMS combination. Click EMS mode, adjust the energy, and then do treatment. Click Start to operate the machine. If we use 2 and 1.5 cartridge, it is recommended HIFU and RF combination. Click RF mode and then adjust the energy from 0.5 joule. Please notice that we should adjust the energy according to the customer feeling when we do operation. Then we can draw the treatment line. Draw a line along the jawline, a line along the cheeks, a line below the eyes. The restricted area is 1 finger in front of the ears, 1 finger away from the side of the mouth. The temples. One finger's distance above the eyes. 1 finger away from the hairline and the center of the forehead. When we do operation, we use the cartridge to measure the distance of treatment. 25 centimeters is the standard distance. And then draw lines. The aorta and Adam's apple are restricted areas. We cannot operate on any restricted areas. The other side of face is the same drawing method. When operating, first applying gel, about the thickness of a coin. And the cartridge needs to apply the gel too. Tightly attach the skin and operate upwards. The smaller distance, the better result it will get. Then we do the second line. Finally, we do the third line. Pay attention to tightly attach the skin when doing operating. Usually, we do the treatment with 4.5 cartridges at first. Then we change the cartridge into 3.0 cartridge. We must ask the customer feeling and then adjust energy. The more densely you remove each line, the better result will be. For clients with sagging masseter muscles or apple cheeks, or those who are aging, we can use a vertical line to do treatment like this. Then we use 3.0 cartridge to do the same method. Now we'll operate to the eye area. Using a 2.0 cartridge, be sure to avoid the eyeball. We'll only need to operate at a location below the palpebral bone. Lift the back of the eye, place the cartridge over the palpebral bone, and operate downward. Repeat 2 or 3 times, depending on the patient's needs. Next, the outer eyelids. And finally, the cow's feet. For cow's feet, we use a figure 8 pattern, followed by vertical lines to enhance the effect. This is for a 2.0 cartridge. Then use 1.5 cartridge to do the full face treatment. Now we'll begin the forehead treatment. 1.5 cartridge is required for forehead operation. Be sure to move slowly, moving both horizontally and vertically. The other side of the face is also operate in the same method. Next, we'll perform the 36 RS treatment. Adjust the energy based on the patient's needs, starting with 0.5 joule. The 4.5 and 3 cartridges are used in HIFU and EMS mode, while the 1.5 cartridge is used in HIFU and RF mode. To begin, use the pedal to operate the 36 RS handle. The 36 RS primarily targets specific areas of the face. For example, if the apple of the cheeks are sagging, focus on these areas. If the corners of the mouth are problematic, focus on areas near them. If the nasolabial folds are problematic, focus on the nasolabial folds. Next, let's operate the 18RS interface. Adjust the HIFU energy starting at 0.5 joule. 2 types of cartridges are generally used. The deeper cartridges, 18, 16, 13, are used for HIFU and EMS, while the shallower cartridges, 10, 8, 6, are used for HIFU and RF. The cartridge size is selected based on the patient's fat content, and obesity level. Now let's begin the operation. Remember to avoid restricted areas such as upper and lower bones, C-section scars, and the area around the navel. First, apply gel to the treatment area. Then select the appropriate cartridge based on the patient's fat content. During the operation, apply a small amount of gel to the top of the cartridge. Press the start button of handle to begin the treatment. And wait until the cartridge stops shooting before moving. You can operate the handle like stamping like this. After one shot stops, stamp the next area, and so on. After completing all operations, if the customer has a lot of fat on the size of waist, do the same way as above. Replace the next cartridge and repeat the same operation. Remember to maintain close contact with the skin throughout the energy output without moving. Note: for the first operation, we recommend using the normal mode for a stamping way. Afterwards, use the MP mode for a sliding way.